Good evening, everybody. I'm Sarah here with our friend Pam at the University of Iowa Stead Family Children's Hospital Safety Store, and we are going to talk safe sleep tonight. So a lot of you had some questions that you left in the comments, both in our group and on our page. If you have new questions or if you just want to hop on and ask those questions again, leave them in the comments. Pam's going to introduce our experts tonight, and they are going to chat about all of the things that you want to know about safe sleep practices, products available that you can get right here at the safety store, and anything else you might want to ask. So, Pam?
Sarah, thanks for coming in here and doing this. We always appreciate doing things with the Iowa City Moms Blog. It's a group of passionate women, and so we think it's a great opportunity to share information about safe sleep. So tonight we have two of my colleagues that sit on our Safe Sleep Task Force here at University of Iowa Stead Family Children's Hospital. We have Heather Eastman and Penny Smith. They're both nursing practice leaders here and experts in safe sleep. And specifically tonight, we're going to get into some conversation about products out there that we see a lot shared in social media lately, and we thought it was a great time to address those products.
Yeah, thank you. Good evening.
Hello.
So if you guys want to introduce yourselves and just let us know what you do here at the hospital, and we'll get started with our questions that we had.
Sure. I'm Penny Smith. I'm a nurse clinician specialist. My background is neonatal intensive care. So I started here in 1986. It's about 32 years of NICU. And for the last 18 years, I've worked as a consultant for Iowa's statewide perinatal care program. And that is a multidisciplinary team of physicians and nurses. We travel to all the birthing hospitals in Iowa. We do chart reviews, we do education with the nurses and the physicians there, and in the process of that, we review every infant death in the state eventually. So we've got quite a bit of experience. We know what's happening in our state as far as sleep-related infant death goes.
My name is Heather Eastman. I am a nursing practice leader, so I will do a lot of education, do a lot of different quality stuff. I serve on the task force with Penny. I've been here a little bit over 18 years and kind of got this group started several years ago, and it's kind of become a passion of ours, and so our goal is just to provide whatever education we can.
Thank you guys for the work that you do. We had some questions come in, so we'll probably start with that, but then please add anything that you guys would like to share. Okay. The first one would be these smartphone integrated home baby monitors, like the Owlet. That's one we hear about a lot. What is your opinion on those, I guess, is where we want to start.
Well, I'm wondering if we want to do a little bit of background about what is SIDS and what that diagnosis actually means. And I'm not sure how much your audience has heard about SIDS, but there's one big term. It's called sudden unexpected infant death. And that's the death of a baby that's less than a year old that is sudden, unexpected, and at least prior to investigation, you don't see the cause for that. So SUID is kind of the umbrella term. And there's several different things underneath that once there is an investigation, it could be infection, it could be a cardiac diagnosis that was missed, it could be some metabolic disorder, it could be trauma or abuse. And then one of the things under that big umbrella term is SIDS. And SIDS is probably the only one there that does not have a cause. Okay. So the definition of SIDS then, sudden infant death syndrome, is death of a baby less than 1 year of age, where after a full investigation, so that's a complete autopsy on the baby, including a full set of x-rays, skeletal x-rays, and a retinal exam looking for bleeding in the eyes, a review of the clinical history, and examination of the death scene. We actually have medical examiners now that are trained to go into the home after a baby dies, and they interview the families. They take a doll with them, and they do a doll reenactment and say, show me, where was the baby when you found the baby? How did he go down to sleep? How did you find him? In what position? Where was he sleeping at the time of death? And they can glean a lot of information in those interviews with the families. But so SIDS is the one thing that we don't know for sure yet, why some babies die of SIDS and others do not. Kids raised in the same family by the same parents, one baby will die of SIDS and others will not. The research is focused on the brainstem. It's kind of the triple risk model, if you imagine three circles that kind of intersect, we think that there's one group of kids that has an underlying vulnerability, something in their brainstem that is not normal.
Interesting.
The second circle would be that the critical period of development, which would be 6 months or younger. 90% of SIDS happens within the first 6 months of life. So that's the second circle. The third circle are those stress factors, those exogenous things in the environment, like blankets and prone sleeping and smoking and bed sharing, all of the risk factors that we know of. And what we think is, when those three circles come together, and if you happen to be that baby that is in that group that has this underlying brainstem abnormality, the kids who live right in the center where those circles connect, those are the kids that are at highest risk to die of SIDS.
I've
So-
never heard it explained that way.
Never
That
heard
is
it
so
either.
interesting.
Yeah,
So what we're focusing on today is that circle that we can control.
we are.
Those
That's
environmental
exactly
items.
right.
So tell us some of the kind of the bullet items of things to just overall reduce your risk of SIDS.
So
The
the
things we
Amer-
can control.
Right. So the American Academy of Pediatrics in 2016, about every 5 years, they update their guidelines. So our last statement was in November of 2016. Some things were changed from the previous statement, but the most updated guidelines tell us back sleeping only, no side sleeping, no prone sleeping.
Back is best. We know
Back
that.
is best. And the previous statement in 2005 actually said that side was still okay, but what we
Okay.
found in the interim was that babies were put on their side, which is an unstable position. They roll prone and they find them bone.
Interesting.
And that's how they die.
Mhm.
So back sleeping, nothing in the crib. No blankets, no pillows, no soft objects, nothing in the crib. It should look like this. If you've seen any information or literature from your hospital or other places, we want the crib completely empty of everything. It should be a firm crib mattress, a standard crib mattress that meets the Consumer Product Safety Commission guidelines or safety standards. So what's considered to be safe is a crib, standard crib, a bassinet,
Okay.
or a pack and play.
Okay.
Those are your three choices
Got
at
it.
this point.
So not like the rock and sleeps that you hear
No.
people raving about for
No.
finally getting their child to sleep.
We have heard so much about the rock and play sleeper over the last couple of years. For a while, it was weekly. But most things about the rock and play sleeper are not safe.
Okay.
It's semi-reclined. It's not flat. That's another recommendation. The bed should always be flat. It shouldn't be elevated. It should be flat. So it's semi-reclined and it's soft and fluffy on the inside. So what happens is, and it's moving, right?
Right.
It's meant
Right.
to rock. So as the thing rocks and the baby moves, he can slide down into a position that compromises breathing. If you think about this, a newborn, at least specifically kids that are less than 4 months of age, big head, scrawny little neck. It's
Right.
not very strong.
Right.
So when he slides down, his chin ends up on his chest or side to side in some position that compromises breathing.
And we did talk about that with you guys, the safety store, at our mom talk about the car seat sleeping
Exactly.
and how we shouldn't be carrying them in the car
No.
seat and leaving them in there. And that's just because they need to be laying flat.
That's exactly it.
Okay.
And what the AAP says about all the sitting devices, the carriers, the car seats, as soon as you get to where you're going and baby's sleeping, take the baby out of his seat.
Sure.
It's better for him to be flat on the floor at grandma's house.
Yeah.
If she doesn't have a crib, put him on the floor. Better for him to be flat and out than sitting in a seat and sleeping when he's not being observed.
We did have a question come in about these boxes that they use. I think in other countries is more common than here.
I'm sorry, Heather, I'm doing all the talking
That's all
here.
right. That's all right.
We kind of divided up the products. We kind of knew what
Yeah.
the different categories were going to be, but the baby box was on my list,
Okay.
and it's been on my list for about a year and a half now. So the baby box is a cardboard box. So you imagine just a storage box. It's about this high, about this long, and maybe about this wide.
Okay.
So a baby up to 4 months of age would fit in the box. So it has a thin mattress that's about this thick. And if you go to the baby box company online, you can buy the box with a bunch of stuff in it. Sleepers and diapers and baby care items. But the box started in Finland in the 1930s. It was part of their maternity package. They had a very high infant mortality rate at the time. So they put this box out there, and it was an incentive for moms to get into prenatal care. If they got into prenatal care by the 4th month of pregnancy, they could get this box sent to them free from the
Interesting.
government.
Huh.
So about, I think, when the Finnish expert came to the Cribs for Kids thing, Pam, I think what I read, she told us 37%, only about 30%-ish of Finnish families actually use the box for sleeping. It's
Interesting.
not just the box that makes Finland's infant mortality rate so fantastic. It's the whole high-quality maternity care that they get that is free.
Right.
It's all either free or very low cost, and women in Finland are off for like a year. They get a paid maternity leave that is really long.
So they're
Glorious.
well,
the box
they're
is
well
part of the
informed.
package.
Yeah.
Exactly, it's part of the package. But what's happened in our country is people have jumped on the bandwagon and thought, oh, this is the next best thing. We can take this box, we can set it in mom's bed, we can set it on a coffee table, we can set it on the floor, and have the baby sleep in it. But the problem with that is that the box does not have any safety standards. Other than the company that makes it, there's no safety standards to say that this is a good thing. And what the American Academy of Pediatrics has said about the baby box most recently, I think it was January 2017, they put out a statement. And Dr. Rachel Moon, she's the chair of the AAP Task Force on Safe Sleep. She's been the chair for a long time. Physician at the University of Virginia
Okay.
Children's Hospital. What she has said, there's too many unanswered questions. We don't know what the air quality is inside the box.
That's what I was wondering.
Yeah.
Yeah.
And is it safe to pick up the box with the baby in that? We don't know. What happens if he pees on it and the cardboard gets wet and it becomes...
Interesting.
Right.
Is it literally cardboard?
It is a cardboard
Yeah, I've seen a
storage
picture
box.
of it.
Wow,
It's kind of
I've never heard of this.
It is.
Yeah.
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 Huh.
What was her other question? Well, I can tell you, Cribs for Kids, the American Academy of Pediatrics, and Charlie's Kids Foundation, all three put out statements in a short period of time in 2017 that against the baby box.
All right.
For the reasons that we just mentioned. Cribs
Okay.
for Kids actually cited a case where a dog, it was a basket, but it was similar to a box, sitting on the floor next to the mom while she's sleeping. A dog reached in and bit the baby on his head.
Oh my goodness.
Not maliciously. You know, baby smelled good. He just wanted
Right.
to play with the baby, but the mom was sleeping, but the baby died.
Oh goodness.
So the question of where do you set the box? Where can he be safe that another kid's not going to crawl in on him,
Right.
or a dog, or whatever.
And the risk for them falling off of a surface was
Yes.
another thing that they had mentioned.
Yep. Yep.
So skip the rock and play, skip the baby box.
Yes.
What should your infant sleep in?
Well,
A crib, but what else?
So a crib, a bassinet, or a pack and play.
Okay.
And the one
There
behind
are
you,
new-
could you talk
the
about-
one behind us is, we feel like we're doing a commercial for Halo here. We do love Halo. They put out some really good products as far as the sleep sacks, and they have what's called the Bassinest, and
Okay.
it's just a bassinet that's
It's
kind of
so
mobile.
cool. Yeah.
It's meant to pull up close to mom's bed,
Okay.
so that the side drops, and I think the manufacturer told us up to 1,000 reps. They tested this guy to make sure he's
Oh,
going to
wow.
go back up every time. But you sit this side next to mom's bed, so if she's breastfeeding, she can just reach over, pull the side down, take the baby, nurse the baby. His bed is right there close, and then he goes right back to bed after
Okay.
feeding.
And that
that's the
bassinet
point.
does meet all of the safe sleep
It does.
recommendations.
It
Okay.
does. Yep.
Good option.
As does the snoo, and there's probably a couple others out there, Pam, that
Okay. I have seen the snoo on Facebook a lot lately.
And the other important thing I think to talk about when you're talking about a sleep environment is really the AAP. They're really recommending now that in a separate sleep environment, but in the same room for up to a year, and they really, really push 6 months.
Okay.
And so that has kind of been a new standard too, that they're really recommending the baby to be close to the families, but definitely a separate sleep.
That was
service.
one of the
Yeah.
questions that came in
Excellent.
earlier today, a few times actually, was how long do they need to be in mom and dad's room? So 6 months is kind of
They're
the bare
really-
minimum.
They're really recommending
in
at
theory.
least 6 months,
Okay.
and with a goal of 1 year.
Okay. Sounds good.
You did mention earlier the outlet, which I think there's some interesting data out there that I think would be important to share, because I do see a lot of moms asking, and I think they think that it can help prevent maybe something by having a monitor, but I think some recent research that Penny can cite a little bit can maybe
Yeah.
tell us otherwise.
You know, the smartphone integrated monitors, when they first started coming out, we thought, gosh, this might be the next best thing. If you go to some of these websites and read at least, and you have to remember, these companies do their own testing. They do their own testing. None of these consumer products, none of these monitors that are marketed for home use are regulated by the FDA. None of them.
That's so important to know.
So these companies do their own testing. Yeah. So no regulations, number one. And like I said, when you go there, you think, gosh, this has got to be the next best thing. But the problem is that technology is just not there yet. There's a recent study just published in August of 2018, and they tested, this was the Children's Hospital of Philadelphia, so very reputable children's hospital, that actually, one of the first that I know of that took two of the consumer baby monitors that are on the market. They looked at the Owlet Smart Sock 2 and the Baby Vita was the other one. And it's interesting, when I went searching for the Baby Vita, it's not available anymore. I suspect that the Baby Vita got pulled because neither one of these monitors performed very well when they stacked it up, when they compared it to a hospital-grade oximeter.
Sure.
And that's what they did. So they took a FDA-regulated Masimo pulse oximeter, a hospital-grade monitor, and compared it, looking for oxygen saturation or low oxygen saturation levels, because that's what these phones say they're going to do for us. They're going to give you the baby's pulse rate, and they're going to give you the oxygen saturation number. But what they found was that these two consumer monitors anyway did not perform very well.
Okay.
The Owlet missed 5 out of 12
Wow.
cases where the baby truly had a low saturation and it read normal on the Owlet. And then the Baby Vita, even worse, 0 for 14, and the pulse rate was off. They just don't perform consistently.
So there aren't any products out there of that kind that you guys would recommend using right now, at least.
No. And what I tell people, you know, if this makes you feel better, then go ahead and buy it and use it. But just don't ignore the safe sleep guidelines.
Right.
I mean, we didn't even get through the whole list of what you should do to keep your baby safe. There's a great list out there. If you go to the Safe to Sleep campaign by the NICHD, the list is there, and we can review it. But just, if you're going to pick a fancy product, just follow the safe sleep guidelines. Don't rely on that thing to save your baby. And you know that one of the monitors, I looked up about 10 of these smartphone monitors, and there are a lot of them on the market right now. I don't know if you guys know that, but the Owlet is just the tip of the iceberg for these monitors. There's a bunch out there. But one was a device that clips onto the baby, and it was actually rated pretty high on this consumer website. But when I looked at the reviews on this thing, the mom had it clipped to the back of his diaper. I thought, wait a minute. And sure enough, she went on to say, yeah, I clip it to the back of his diaper because he normally sleeps on his tummy.
Oh, goodness.
So we could go back to 1992, and I could tell you how horrible prone sleeping was and how many babies died in this country. That right there was such a red flag. That's what we don't want people to do.
Sure.
Put this fancy monitor device on your kid and then totally ignore what the safe sleep recommendations are.
Right. So I think what's really important for our readers and people viewing the video to know is that they can call the safety store or come in here and talk about products, because there aren't a lot of resources for us moms to know, you know, if you see a product and you see a lot of people saying it's good, how are you to know if it is good? And you telling us that a lot of these companies don't even follow the regulations is scary.
Yeah, they just don't have federal standards.
Right.
They're not held to the same standard. It's a consumer device, and if you read the disclaimers, all of these companies have disclaimers on the website.
Of course they do.
The Owlet very clearly states this is not a medical device.
Right.
So don't
treat it like one.
Exactly.
And I think you made a good point. We recently had someone reach out to Pam in the safety store about a product, and they actually brought in several of us that reviewed it, kind of went over the pros and cons and the risks to kind of give them the best advice that we had. And so we're definitely open to do that. We're not a consumer report review board, but happy to give our input. I would say the one product out there that I see a lot that has me a little bit concerned, I would say, is probably the DockATot. There are other similar products out there.
Just had a question come up about that.
Yeah, so my biggest concern with the DockATot is if you actually look at the warning label from the company, and they very much say that to follow sleep guidelines from the AAP's recommendation, and back is best, and they talk about a lot of the other things we talk about with, no blankets and things like that. But they do talk about a safer co-sleeping environment, which we know co-sleeping in general is very much a high risk factor for a lot of kids. And I think a recent study showed that 70% of children that had died of potential SIDS were not in a crib environment. So I think that kind of tells you a little bit right there. The crib is really the best. But so my concern with the DockATot, the warning actually says on there, it's a very soft-sided thing that the baby kind of snuggles in. Very easily I could see that they could get into a position where they were breathing the carbon dioxide. And so that's really what you risk for when you have them thinking about kind of that pocket of air that they're bringing if they get sideways. And the company actually does on their warning, they say that is to be under direct supervision at all times. And so my thinking is, if you're really using it as a sleeper and you're sleeping, you're not under direct supervision.
Right.
So I honestly feel that if there was ever a case there, a parent wouldn't have anything to stand on as far as using it as a safer sleeping environment. So that's my risk factor. If you're really going to be watching your baby take a nap, things like that, I think that's a different situation than actually co-sleeping together with your child. And there are a lot of other products besides the DockATot. I'll tell you, that's the one I see the most often now.
Okay.
Getting some buzz. Good. That's good to know.
Yeah.
Let's backtrack a little bit and talk a little more about those basics. We see the whole wall of sleep sacks behind you, which you've already said that you love. Tell us why sleep sacks are important and why they are safe.
We love sleep sacks because a wearable blanket's what's recommended. So if we're not going to have any loose blankets at all in the crib, you've got to keep your kid warm. So the purpose of these is they're sleeveless, so you can layer this kiddo up underneath. If it's winter, if you need to put a onesie and a long sleeve sleeper on, like our little dolly here, you can do that. And then the sack is sleeveless, so it goes on. And this actually is a demo sack, the one we're looking at now by Halo. So there's no Velcro on this. But the commercial product, all of these have Velcro. So when you wrap this guy around here, he's going to stay in place and attached to the sack. So
And their arms go inside.
Arms go, see, it's sleeveless. It's sleeveless, but when we swaddle him, we're going to put arms inside. Let me point out the zipper. I love these guys because they're smart. They zip from the top to the bottom.
They are the best.
So the zipper's at the bottom. It's not up in the kid's face.
I love that.
So he's in a sack, and remember, there are sacks, just a sack. You can buy just a sack on the wall. If, after 3 or 4 weeks, kids don't want to be swaddled anymore. They want their arms out. So in that case, you would either lift their arms and then put the swaddle around their chest. Yep, Heather can demonstrate. Then it just becomes an extra layer, like an extra blanket, only he's wearing it. And imagine that it's Velcroed, so it's not going anywhere.
Right.
The wings of this guy can't come up over his face like a loose blanket. But for the baby that's swaddled, we just want to make sure that when we swaddle, that we're swaddling kind of away from his face, and we are going to bring his hands up. When I swaddle, babies love this. They love to have their hands up by their face or by their mouth. So we'll bring their hands up. The first guy comes across like this, and he's going to Velcro down here. And then the longer one comes across like this. And we want to make sure that the wings aren't way up here under the chin. We want them down a little bit and kind of pointed down and to the back and Velcro that way.
Yeah, the Velcro has 2 straps that go across, so depending on how loose or tight you want it and the size of the baby. But I think the other important thing is to make sure that you're not swaddling. We really recommend past 2 months of age, or if your baby is sooner showing signs that they're going to roll over, you don't want them to be swaddled with risk of them rolling to their side. So that's when we would definitely recommend leaving their arms out. So if you have the ones with the wings, make sure you're swaddling under their arms, or switch to one that doesn't have the attached wings to it.
Perfect. And you guys have all of the varieties here, it looks
Pam
like.
has everything we need.
And we've talked about this multiple times, but the price is so important because, that might be a factor for some people not purchasing them, and we appreciate that you guys kind of take that out of the equation.
Yeah, they price them so low here.
Yeah.
We do have like a thin cotton all the way up to the more fleece. So depending on the time of the year, the age of your child. all the
And
way from
various
one up to-
sizes. I love
Yes,
that.
yes.
Yeah.
Right.
Cute patterns.
Yeah, they are cute.
I just grabbed the next size for my 9-month-old to get her through the winter.
Nice.
So
Yeah.
I have a granddaughter. She at 2 years, she was still sleeping in her sack. She loved it.
that's a great. Actually, we have a question on here. How long do they need to be in sleep sacks? When can they transition to regular blankets, pillows, stuffed animals, those type of things?
So I mean, if your child is not wanting to be swaddled and they're in a regular, pajama outfit, that's okay too. Definitely, we don't recommend any blankets, pillows, anything of that nature. Our guideline is always 1 year of age.
Okay.
After that is kind of when they're more towards the toddler, where they're more able to move around and things like that, and we would allow that. But up until 1, we really like just alone in the crib with nothing else in there.
That is the AAP. That's their cutoff, 1 year of age.
Perfect.
Okay.
That's when you can put a pillow in the crib and a blanket and their little lovey thing. And but before that, you want to keep all the stuff out of the crib.
Another thing that comes up sometimes is pacifiers, and
Yeah, I was just gonna
the
say
use
that.
of pacifiers is actually something that they say reduces, and it's a protective
Mhm.
measure. That doesn't mean that if your baby falls asleep, you need to put it back in.
Right.
If your baby won't take it, don't force them to take it. But it is something else that is one of our recommendations if your baby does take it.
So if they do take a pacifier, they shouldn't have the ones with the stuffed animal attached. I'm
No,
assuming,
no
but just wanted to
attached
point
to
that out.
Thank you.
Because I know a lot of-
Clip
that's
it
what
to
a
their
lot of people
clothes
use
and
now.
No, we just want
Yeah.
the loose pacifier.
Okay.
Yeah. So if he spits it out, then it's not a danger.
Right.
Yeah. I mean, like she said, you don't have to keep sticking it back in.
Mm-hmm.
But if he takes it, if he accepts the pacifier for that sleep cycle, the protection exists for the entire sleep cycle, whether or not he spits it out or not.
Oh,
He
wow.
just
Interesting.
has to take it and start to suck on it. And
Huh.
there's something about the sucking that keeps them out of the deep sleep where they're at higher risk for SIDS.
That's amazing.
Yeah.
Good to know. I had another question too, and now it just.
I mean, we could sit with you
Just
all
slipped
night and
my
ask
mind.
questions.
Yeah. Oh, okay. Here's one. So, you have your baby all wonderfully swaddled and in their safe sleep environment, and then they start to learn to roll over, and you're constantly paranoid and flipping them over all night because back is best. So, at what point can you rest easier knowing that if your baby tends to just roll right over when you
Mhm.
put them on their back?
I can answer that. You don't have to keep flipping them back over.
Okay.
Once they can roll over from front to back to front, you can leave them in the position that they assume once they're
Okay.
asleep. But the important thing then becomes that you don't have anything in the crib that they can roll
Right.
into.
Mhm.
The bumper pad desk that I just was reviewing this last week, those kids were rolling around. That's what happened to them.
Mhm.
They either got caught in the bumper pad
Okay.
or they rolled into that soft surface, and rebreathing, that
Mhm.
potential for rebreathing then was a
Right.
problem for those babies, and
Got
they
it.
suffocated.
Good to know.
So,
I
yeah,
did have a
nothing
question
wrong.
about the crib, how far from the wall it should be. I think she's asking about like them crawling out or getting stuck between the crib and the wall.
Golly, I don't know if there's a set. I don't think that there's any set standard that says your crib should be so far from the wall. What you want to look for though are blinds, and
Right.
corded
Cords.
blinds, particularly anything
Mhm.
that they can get a hold
Devices,
of.
yeah, that they can reach through and get a hold
Right.
of.
Right.
And I think back to the bumper pads, I think it's important to note that there are some that are marketed as safe sleep, like mesh and
Oh,
certain
good
bumper
point.
pads, they market them as breathable, but
Mhm.
we still really recommend you stay away from
No bumper
those,
pads.
Yeah.
just because of the risk of entrapment, and what does rebreathable really mean, and what is that tested to
Mhm.
mean, and so it's still definitely a risk factor, and it's really not a necessary product, so
Yeah.
we do recommend to avoid them.
Okay,
Perfect.
Yeah.
All you need is a mattress and a crib sheet.
Yeah.
Mhm.
Perfect.
Yes.
perfect.
Mattresses, I think, is maybe another
The breathable mat.
the
Heather can talk to you about the breathable mattresses. There's some special mattresses that are on the market. Pam has had requests to order some of these products in, but
yeah. So we've just noticed that there are some new mattresses out there that are considered to be breathable or that reduce the risks of SIDS. And like we said earlier,
company
yeah,
says
like
they do.
like
Mhm.
Penny said earlier, we don't really have any good testing to prove any of that. And while we may say that maybe they could be beneficial, we're not, suggesting that people go out and buy anything other than a standard crib mattress at this point. As long as you follow all the other safe sleep guidelines, you should be fine. But there are several out there. The Newton, I think, is one for sure that I've heard a lot about. And
Secure Beginnings.
Secure Beginnings.
Beginnings is like a plastic frame, and it's a breathable, that's what the company calls it, cloth that stretches over the frame of this thing. So it's not
Okay.
even really a mattress.
Okay.
It's just a stretchy piece of fabric on a plastic frame that's totally open underneath.
Interesting.
And again, that's one of those things you go on the website and you start reading the research, and they've got physician sponsors, and it seems compelling. And really the AAP has maybe the softest statement about that product in particular, the special mattresses. And what they say is, if it's a mattress that meets the other standards, basically it's no harm, no foul.
Right.
You can use it, go ahead and use it, but we don't believe yet that it will do what the manufacturer says
Okay.
it will
Got
do as far as
They
being
don't believe
breathable.
that it's necessarily better than
Better.
the
Well, they
originals.
think that there's not enough data yet to recommend it. Let's
That's
use
good.
the right terminology.
I
That's
think,
what
and
they
a
say.
lot of it focuses on the rebreathing. It's really hard to
Yeah.
to
And they've
quote
tried-
that and where a baby is laying and
Yeah.
how do you measure that?
They've tried to measure it. The Secure Beginnings, if you go onto that website, they've made their own mannequin lab. I mean, they tried to measure
Sure.
the CO2 that ends up right in the baby's face if you were to turn prone. And that's their biggest marketing thing, I think, is they say, so when your baby does start to roll over, our mattress is safer because it's more breathable than
Right.
the standard crib mattress.
Got
So
it.
that's the marketing
Interesting.
strategy there. So, and I guess I'm going to say this: no harm, no foul. If you want to spend $300 on a crib mattress, but just pay attention to the rest of the safe sleep guidelines.
Right.
Put him on his back every time you put him down, and just no blankets.
Okay.
Good recap.
Yeah.
And of course, if you see a new product and you're not sure if it meets the requirements, you can always call or email or stop by the safety store and ask the experts here and make sure that it meets all of those recommendations and requirements to keep your baby safe.
Yeah. And thank you so much for the work that you do.
You bet.
Yeah.
You bet.
Thank
Thank
you.
you for coming out and showing an interest in this topic. We're very excited to share it with anyone who will listen. So thank you.
We appreciate it.
We could ask you a never-ending list of questions about safe sleep and all of the other safety topics. So everybody that is rewatching later, if you have questions that weren't touched on live today, make sure that you ask in the comments, and we will circle back to our experts here at the safety store and make sure that we get those answers back to you.
Yeah.
Thank you again, ladies.
Thank you.
Thank you.